Hello and welcome to this recorded meeting to discuss the employee benefits for Care Choice Health Systems beginning January 1st, 2023, going through December 31st, 2023. My name is Bill Hammett. I am your insurance expert, proud to be. Also on the team is Rhiannon, who's your account manager, and Anna, who is the benefit administrator. All of us are available to you all year long if you have questions about your plans, need help with ID cards, need some help with a claim that's not going your way, whatever it may be, you can lean on us throughout the year. During open enrollment, if you want some help comparing the plans to one another and choosing which one's best for you, I'm a great resource for you. My information is right there on the screen. So today we're going to talk about the timeline of open enrollment, the medical plans available. We'll talk about dental and vision plans. We'll do a little quick screenshot tutorial on how do I enroll. And then, of course, where do I go with questions? You are welcome to reach out to us if you have questions. So what is open enrollment? Open enrollment begins Monday, November 28th, and it goes through Friday, December 9th. This is the time of year where you can change plans. You can add people to your plan. You can remove people from your plan. You can enroll in dental or cancel vision. You can literally do anything that you would like during this period of time. Once the period of time is over, then you will be on the plan for the year, unless there's a qualifying event, which allows you to be eligible for other coverage. Or if you were to waive this coverage and then middle of the year lose that other coverage through your spouse or through your parents or something like that, then you would be eligible to join the plan in the middle of the year. So any changes you make during this period would actually happen on January 1st, 2023. We're asking everybody to complete this by Friday, December 9th, and you'll do so through the EASE Benefit Enrollment Portal. So we have 9 insurance plans available. We have 3 HMO plans from the Harmony HMO network, which serves mostly sharp doctors. We have 3 HMO plans through the Alliance HMO network, which is specifically Scripps providers. Also, Rady's Children's Health Network is involved in that too. And then we have 3 PPO plans. And of course, PPO plans are the plans that allow you to see the most number of providers. And you can self-refer to specialists. You can go from network to network. You could go to Scripps one day and Sharp the next. So PPO plans are going to be more expensive, but they're great for people who value freedom of movement throughout the healthcare systems. So here's our HMO plans. I know we said we had 6 of them and you only see 3. It's because there are 2 silver plans, 2 gold plans, and 2 platinum plans. There is a Harmony Silver plan and an Alliance Silver plan. So if you prefer mainly sharp doctors, you would choose the Harmony Network plans. If you prefer Scripps doctors, you'd be looking at the Alliance plans. Now, I've put them together as one because the benefits are identical between the 2 plans. Between a Harmony Silver plan and an Alliance Silver plan, the benefits are absolutely identical. So when you're looking at Harmony versus Alliance, you are choosing in the network. The Silver plan benefits will be identical. So let's talk about those benefits. So we have a deductible here at the top of $2,400. A deductible is, generally speaking, what an insurance company says you must spend all of this number before we start to pay for any benefits. Now, there are exceptions to this, and it's important to note what they are. Wherever you see this term DED waived, it means you get this benefit, this copay, with the deductible waived, meaning you do not have to meet a $2,400 deductible before you get the chance to pay only $60 as a copay to see a regular doctor or $95 to see a specialist, deductible waived. If I need diagnostic lab or x-rays, $45, deductible waived. If I need a CAT scan, a PET scan, an MRI, complex imaging of some sort, $400, deductible waived. Physical therapy, occupational therapy, speech therapy, $60, deductible waived. All the way down here, urgent care, deductible waived. So these silver plans actually are really, really strong in their benefits, because if you're someone that just needs doctor visits, some lab work, an x-ray here and there, maybe a little rehab on your knee, some generic drugs, and then maybe an urgent care visit, all of those things you would never touch your deductible for. So this is a really good plan for those of you that want to save some money, but might need to use some of the day-to-day type of benefits. Now, where it becomes more of a problem and becomes less valuable of a health plan is once we get down into, well, certainly prescription drugs. There's a $400 brand name drug deductible. So before you get the $80 or $25 copay, $125 copay, you have to pay the first $400 out of pocket. But then notice down here at hospital stay, surgery, emergency room, 40% after the deductible. Now, what this means is that if I have a hospital stay, let's say it's $100,000, I'm in there for 4 or 5 days, $100,000, I would pay 100% of the costs for the first $2,400. Then I would pay 40% of the cost. United Healthcare pays 60% of the cost until my deductible to $2,400 plus my 40% of the cost of this hospital stay equals $9,100. Once I've spent out of my pocket $9,100 in a calendar year, I pay nothing else for the rest of that calendar year. So through the end of the calendar year, once I've spent $9,100, I pay nothing else for covered services from network providers. So this $9,100 includes these copays you've been paying for office visits and lab and x-ray and pharmacy deductible and urgent care. So let's say you already spent $1,000 in copays. That means you only have $8,100 left to go. So in that scenario, we would only pay $8,100 on that $100,000 claim. So the point being is that this out-of-pocket maximum is an important number. Every dollar you spend throughout the year is rolling towards this number. It's not necessarily true of the deductible. Copays don't go to the deductible, but they do go towards the out-of-pocket max, which ultimately is good. So once you hit this out-of-pocket max, that's the most you would spend. Now notice over here on the gold and platinum plan, 0 deductible, so that's very attractive. You're never out 100%. Out-of-pocket maximums are lower at $7,500. That's much better. $3,000. That's fantastic. That means the worst case scenario throughout a calendar year for an individual in your family would be $3,000. Copay is much better throughout the whole plan. No brand name drug deductibles, but really the benefit is this hospital stay, surgery, emergency room. Notice that both of these plans have flat dollar copays here associated with that benefit rather than a percentage. This means 2 days in the hospital on that gold plan, it costs you $1,400, whereas with the silver plan, it would cost you your $2,400 deductible plus 40%. So you're probably looking at most of that $9,000 out of pocket. Also, emergency room is a flat dollar copay for both these plans, which is good, and surgeries are a flat dollar copay. So that's how you look at these plans. The silver plan, great for those of you that just want something that's low cost, that's there if you need it. And even for those of you that want low cost but still need some x-rays and doctor visits, really pretty good plan here. Gold plan will cost a little bit more, but really good for those of you that might anticipate an emergency room visit, a hospital stay, a surgery, prescription drug costs. And then the platinum plan is great for those of you that know you're going to have expenses and want to spend a few more extra dollars out of your paycheck to buy a better plan, which, by the way, is tax-free, so that when you have the platinum plan, your out-of-pocket expenses are much lower, and that's after tax money you're spending. So if you know you're going to use a lot of health coverage, I'd look at that platinum and gold. If you know you don't need much in the way of healthcare coverage, that silver plan is great, and the gold is a good middle-of-the-road plan for anybody. Here's our PPO plans. We have a bronze level plan. This is really a catastrophic plan. Notice high deductible, $7,500. Once you get into your office visits, lab and x-rays and imaging, prescription drugs and hospital stays, urgent, everything is after the deductible. So really, truly just a catastrophic plan. It will feel like you don't have insurance for the first $7,500. The silver plan is a good value plan. $1,950 deductible, not too high, not too low, save some money. Doctor visit copays, physical therapy, occupational therapy, speech therapy copays before the deductible, generic drugs before the deductible, urgent care. So good PPO plan. And then, of course, the best plan we have is the Select Plus Gold PPO plan, lower deductible, lower out-of-pocket max, lower copays across the board. Those are our PPO plans. Let's talk about dental. We have dental through Delta Dental and Emeritus. Delta is our HMO dental provider. There is a bronze, silver, and gold plan here. This The bronze plan is going to be your low cost one, higher copays, really good for just a couple of free cleanings a year, very inexpensive. Silver plan, a little bit better as far as lower copays. Gold is going to have the lowest copays, but costs you the most. So HMO plans don't cost as much out of your paycheck, but they don't let you see as many providers, so smaller network of providers. PPO dental plans, if you are interested in a lot of choice, your PPO dental plan is going to be the way that you want to go. The PPO Silver plan will be your lowest cost plan, but it has a calendar year maximum of 1,100. PPO Gold maximum of 1,600. PPO Platinum 2,100. Now this calendar year max is different than what we talked about with medical. With medical, we said calendar year max, meaning once you hit this number, United Healthcare pays everything else and you pay nothing. With PPO dental plans, it's the opposite. Once you reach your calendar year max, that's your benefit maximum for the year. Once on this PPO Gold plan, you hit $1,600 in benefits that Emeritus has paid out. They don't pay anymore and you pay everything else. So that's a big drawback with PPO dental plans, that, and they're more expensive than HMO, but a lot more choice of providers. Everything is not a copay, it's a percentage. So preventative care is 100% covered. Basic is 80% for the silver and gold, 90% for platinum. Major is 50% for each of them. Notice in that silver plan, the endodontics, that's root canals, and periodontics, deep cleaning, that is in the major category. Within the gold and platinum, it's basic, so they would cover more of that. Also to note, the calendar year max is a per person in your family amount. So if there's 3 of you in the family, that's 3 $1,600 maximum. So it's not 1,600 divided by 3 people. Each person gets 1,600 of their own. Our vision benefits are with VSP. Both of these plans are identical in every single way except one. So they both give you a $10 eye exam copay once every year. They both give you standard lenses at a copay, $25 copay once every 12 months. The gold plan, however, makes you wait 24 months for your frames allowance of $180. The platinum plan gives you that benefit once every year. Both of these plans are good. Both of them have the same exact network of providers. I think the platinum plan is a much better value because for what amounts to about $23 as an employee only more per year, you get $180 of tax-free benefits. So this benefit also applies to the contact lens allowance. So this would be elective contact lenses, $150 allowance there. So that's kind of an or. It's $180 for frames or $150 for contact lenses. So for those of you that have contacts and glasses, platinum is great because you get new frames 1 year, new contacts the next, and so on and so forth. So let's talk about how we enroll. We're going to enroll the same way we have in the past. We're going to enroll through a portal called Ease. You're going to be looking for an email that looks just like this. It's going to come from the Care Choice Health Systems Benefit Management department. It's going to say now open, employee benefit, enrollment portal, mandatory, blah, blah, blah. It is mandatory that everybody log in. If you were getting this email, it means we believe you're eligible. You need to log in and say, yes, I would like the benefits. No, I would not like them. If you have done this before, it's going to pre-select what you've elected before. So if you've elected to waive coverage, it's going to pre-select that and it'll be a breeze. Take you 2 seconds. If you want to renew your coverage that you already have, also doesn't take much time at all. Go in there, it's already pre-selected. You should be very quickly able to get through it. So you'll hit this login button. You'll go to the carechoice.ease.com site. You'll log in. If it's your first time, you'll create a password. Once you get in, it'll ask you for all your individual demographic information, name, date of birth, social, address, phone numbers. It'll ask you this information for your dependents. You'll kind of keep skipping through the system until you get to choosing your medical plan. It'll look something like this. There's going to be an area that's very easy to miss. It says specify your coverage. Right here, it's going to list the people that are loaded into the system, and it's going to give you a check mark or an X. If it's your first time in the system, it's all gray. These boxes are gray. Pardon me. So what you want to do is you go to the check mark and hit the check mark if you wish to enroll, and you hit the X if you wish to waive the coverage. When you hit the check mark, it'll turn green. When you hit the X, it'll turn red and ask you to identify why you're waiving coverage. Once you hit that check mark yes, you're going to get to you're going to be able to scroll down and see the different plan options. You'll see buttons next to them That'll allow you to select them. Once you select one of the plans, it'll say selected. It'll draw a green box around it. You'll see the rates on the top right on a per paycheck basis after the contributions for your company have been pulled out. You'll see links underneath each of these plans to get more information on the plans and how to locate doctors and all that stuff. Once you get through the medical, the dental, the vision, it's going to give you a summary of what you've chosen. You'll review that. If you like it, you'll hit continue. Once you hit continue, it'll give you the option to sign forms. You'll click sign forms button. You'll type your signature. You'll write your signature with your mouse, or if you're using a mobile device, you can do it right on the screen there. Next. It's going to take you through each of the documents and let you just plug that signature into everywhere it needs to be. Once you get all the way to the end of that, you hit a finish signing button at the top right and you're all set. So next step is just to look for that email. Go ahead and log into the portal. Go through all of it, make your choices, use all the links to get more information on everything. If you have any questions, if you need any answers, we'd be happy to help. It's a pleasure to be your broker. It's an honor. Thank you for listening to this presentation, and I hope to speak to you one day soon.